The CDC is tightening testing requirements for foreign travelers. This comes as cases of the Omicron variant have been reported in at least 20 countries and territories. David Begnaud reports from JFK Airport in New York.
Two things. The CDC is going to be increasing testing surveillance at the arrivals terminals at 4 of the nation's busiest airports. We're talking Atlanta, San Francisco, Newark, and John F. Kennedy, where we are here in New York City. Also, within the next 24 hours or so, we expect that there's going to be an announcement that affects just about everyone traveling to the United States. Late last night, the CDC confirmed they are working to modify the testing requirements for travel into the United States. Right now, travelers have to be tested within 72 hours of departing to go to the United States. But the White House may soon announce that travelers be tested one day before boarding flights, regardless of their vaccination status or the state of COVID in the country that they're coming from. In the U.S., the message is consistent. Get vaccinated, get your booster, do it now.
We have far more tools to fight the variant today than we had at this time last year.
One of those tools could be the at-home pill from Merck. That would fight the worst symptoms of the virus and lower hospitalizations and deaths. An FDA advisory panel on Tuesday recommended its use. It is now up to the FDA to sign off. Meanwhile, there are labs around the U.S. testing right now to see where Omicron will pop up first.
We're sequencing the COVID genome of thousands of positive COVID samples.
We went to the Pandemic Response Lab, which is just outside New York City, to meet John Laurent. He is head of research and development here. The U.S. is sequencing 80,000 positive PCR tests every week to look for variants. That way, they can determine how fast the variants are spreading and how infectious they are. About 2,000 of those sequences occur right here.
Our turnaround time here, once we get a sample in, is about 3 days.
Right now, it is the Delta variant that makes up about 99% of the cases worldwide.
How long did it take for Delta to become the majority of all COVID-positive patients in New York City?
Thinking back on that, I think it was probably 6 to 8 weeks from the time we first sort of saw it and then really saw it take off. And it took off very quickly.
That's pretty fast.
Yes, it was very fast.
So is it your guess that once you detect Omicron, within, let's say, a month and a half to 2 months, it could be the majority of everything?
It could definitely be.
Think about that. One more thing before we go. To our north in Canada, they have a new rule that affects everybody. If you're 12 and older and you are not vaccinated, you can't travel by plane or train. A negative test is no longer accepted as a substitute. Anne-Marie?
All right, David. David, thank you very much. Joining me now is Dr. Susannah Hills. She's a pediatric airway surgeon and assistant professor at Columbia University Medical Center. Thank you so much for joining us. Okay, let's talk about this. Everyone's reacting to this new variant. The CDC is now recommending stricter travel restrictions for people entering the U.S., moving from a 72-hour testing to 24-hour testing before flights. I assume we're talking about the rapid test because the other tests, take a few days to get the results. So presuming it's a rapid test, what sort of a difference could this make, the difference between getting a test 3 days ahead of time versus, 24 hours ahead of time?
Yeah, I mean, Anne-Marie, it's difficult to predict. We don't know for sure. I think the bottom line here, though, is that taking proactive measures like testing, like travel restrictions, and really implementing these things early is a much more effective way to potentially curb the spread of this virus. When we've gotten behind in this disease and managing this virus in the past, it's because we've been in a reactive state. And we've been a few steps behind here, taking these measures to test early, to test rapidly, to get results in 24 hours, and to limit travel and really keep on top of contact tracing with that testing. I think it is really an important and critical step in trying to curb the spread of what could be and appears to be a much more transmissible variant.
So, I said earlier today that when it comes to the Omicron variant, it seems like we are, at least right now, in a bit of a information vacuum, but not an opinion vacuum. Everyone seems to have an opinion, and some people are actually, people that are well respected, like the CEO of Moderna, who suggested that he believes the coronavirus vaccines will have a diminished effectiveness with the Omicron. But we don't know that much about this variant. So keeping that in mind, doctor, what advice do you give regular people about how we should approach this? Should we be concerned, or is this no cause for panic like the president says?
Yeah, the first piece of advice that I think most healthcare providers, including myself, are recommending is to go out and get vaccinated. We don't know exactly what the severity of this disease will be. So far, case reports suggest that it's mild. We definitely don't know that based on scientific data or rigorous evidence. There are a lot of mutations, many more than we've seen in the other variants in this Omicron variant. And so these mutations will likely confer increased transmissibility. But at the same time, the vaccines that have been so effective against the other strains that we've had work effectively at the area of the spike protein, which is where this virus attaches and gets into the body. And it's likely that these vaccines will still be, to some degree, effective even against this highly mutated Omicron variant. So going ahead and getting vaccinated absolutely makes sense. It's still likely to confer protection. We'll learn a lot more in the next 2 to 4 weeks as we get more data and study the virus more.
In the meantime, it looks like we have sort of one more tool to keep people alive if they are particularly susceptible to this virus. And earlier I spoke to the chair of the FDA panel that recommended the Merck COVID-19 pill for approval. It's an antiviral pill, so you have to already have tested positive for COVID in order to take it. I asked him who would qualify for this drug, and I want to play a little bit of his response.
The current state of the data are those individuals who test positive, so they have COVID, not worried about COVID, and are at high risk for progression for severe illness, meaning hospitalization or death. In that setting, the benefits appear to outweigh the risks given the data available today. I don't think that this is a pill that's meant to make a cold a little less bad. I don't think that's the way we should be thinking about our anti-infectives in general, because that can promote resistance and have side effects with less benefit. Where the benefits are greater, then the risks are manageable. But there's no medicine without risks, not even penicillin. Penicillin has risks, yet we all take it routinely when we have an infection, a bacterial infection. So it's a balance.
So this panel that voted, it was a kind of a split decision almost. It's a pretty close vote. What do you make of his assessment as to why they voted to, move this process forward? Do you have patients, in your care that you would recommend this drug to should they find themselves contracting COVID and in need of care?
Yeah, there are a couple of takeaways from what I just heard, Anne-Marie. First of all, what he's saying here is that this is for patients who are at high risk for progression to severe disease. So it's not for everybody. It's not a preventative tool. It's not something that a healthy person with mild symptoms who's not at high risk for severe disease should be taking right now. It's also a medication that should be used in anticipation of progression, meaning early on, so to prevent progression to severe disease. But it's not likely to be something that's going to be, a first line or super effective treatment for patients who are severely ill or in the hospital. It's to prevent people from getting to that stage. And I think that message is really important. It will likely be a really helpful tool for a whole lot of patients who are testing positive, who have disease, who are at risk. And I think it's a really important modality moving forward. It's this medication, these antiviral medications are likely to work against variant strains, regardless of the mutation, really, because they don't act on the virus itself, they act on the replication process. So it could be very useful in settings where viruses are starting to get away from our immunity from our vaccines, but it's for people who are at higher risk. It's for people before they get to a stage of severe disease. And also, they one caveat, they have not approved or recommended this medication for pregnant women as well. So if you are pregnant or think you might be, this is not for you yet.
Doctor, I want to ask you about a study that was published in Frontiers in Medicine. It shows that people who survive severe infections actually have double the likelihood of dying within a year. Can you help us understand why that might be?
This study is so interesting, Emery. What they found was in looking at people under the age of 65, there was this incredibly increased risk of death. So it was younger people, not the older population you might be inclined to expect. In addition, people were not dying from COVID complications, not the issues that we expect, the respiratory issues, the pneumonia, the consequences of that. It was more a reflection of a general decline in health and overall mortality or overall death being increased in this somewhat younger population in the year following a severe infection, but not specific to the COVID infection itself, more for other reasons and a reflection of how this disease can really affect the overall health even of young people in the year after severe illness.
I tell you, it is scary. The best thing is to not contract this virus at all. And like you keep reminding us, get those shots. Dr. Susannah Hills, thank you so much.
You bet.